common sight in Uganda. Many families rely on charcoal for cooking. But Amy Wasira says cooking with solid fuels is a growing public health hazard.
My mother, I remember I used to spend at least 3 days at home or in the hospital looking after her because she was ill. Little did I know that she was suffering from at least a medical condition. It was not until when I went to medical school that I realized that it was not only my mother, but even other women outside there were suffering from ill effects of cooking energy.
A trained medical doctor and public health practitioner, Wasira treated many victims of household pollution. He's now chosen to try and prevent these problems before they arise.
But you can imagine this woman who spends between 9 to 11 hours in the kitchen cooking. What does she breathe in? Carbon dioxide instead of oxygen. Instead of setting up a hospital to treat patients who come with indoor air pollution, probably it would be better if at all we could treat them with a preventative method of clean cooking fuels.
His company, West Gas, has invested up to $300,000 in a plant that produces gas from locally available biodegradable waste. Having started 5 years ago with 45 clients, West Gas now reaches more than 6,000 families, and the company hopes to supply about twice that number by the end of 2015. Anita Atuhire is one of the clients. She is a beneficiary of the company's scheme that allows low-income earners to acquire gas on credit.
If I cook using charcoal, smoke fills the house, soot gets on the clothes and it gives me headache. With gas, cooking is now convenient and smoke-free.
Statistics by the World Health Organization show that 3 billion people light and cook with solid fuel, and that 4.3 million people die annually due to household pollution-related illnesses. West Gas believes this trend can be gradually reversed if people could start using gas cookers and lamps for lighting. But in a country where more than 50% of the population lives on less than $1 a day, many families cannot afford gas and will still have to rely on charcoal and firewood. Hilary Yesiga, CCTV, Kampala.